the channel. So this is our YouTube channel where we try to do educational pieces in a fun manner. We answer some of the most basic questions and some of the hot topics when it comes to aesthetics. So today, let's talk about nasolabial folds. So there's a couple ways you can address it. You can address it by trying to lift the laxity off that area. The traditional way that most people know about it is just taking filler and plopping filler into that area. So that's not really my preferred choice, but we'll go over some of the ways I look at it, how as a provider we should look at it, and then also as a client, how are you looking at it as well. Let's figure out what's going on in this area. In one of my previous videos, we talked about the who, the what, the where, the when, the why, and the how. So we'll link that to the description below on how I look at aesthetics and how the client should look at aesthetics as well. So when we lose, or let's just say when we age, we lose bone, we lose fat, and we lose collagen. Bone and fat are our volume systems. Collagen is what keeps our skin nice, firm, and taut and lifted. So in this region, what happens is as we age, we lose volume in the cheeks, in the mid-face, and then we lose some volume in here as well. But when we lose volume in this mid-face and cheek, what happens is all this skin that used to be held back here starts drooping and descending forward and down, and that's how we get the laxity here. So I'll pull up a picture to compare a mother and daughter in regards to why does the mother look 60 something and why does the daughter look 20 something when they generally have the same features, but it's those little mini changes in regards to volume loss and collagen loss that makes the biggest difference. One way you can fill this area, or one way you can correct this area, is with fillers. So you take a hyaluronic acid filler, whether it's Juvederm, whether it's Restylane, any other number of fillers that you can use, and people will come in and say, hey, can you fill this line for me? Because what they're seeing is the volume loss that's descending down and causing this heaviness, and secondarily through animation, when we smile, we compress onto that heaviness, so it forms this wrinkle even deeper. So yes, you can fill this area, but it doesn't fix the cause. And whenever it comes to aesthetics, I don't like to just mask the situation, but if we can fix what's causing it, you get a better result. So if we stick to just fillers, what we do is we fill the mid-face, we fill the lateral cheek to lift and elevate the tissue off of this area. So one way you can look at it, or one way I show you here in the office, is if you smile, you can see it elevates the cheeks and it makes you look more youthful. And that's kind of what you're trying to do. Give back volume strategically. One, you're correcting the sculpture of the face, and then secondarily, you're fixing what you're trying to correct there. So fill this first, mid-face, lateral cheek. Once you've hit your endpoint, then you can come in and take filler to spot fill this. Another reason you don't want to just fill this central area is because in a typical face, your volume systems are on the outside. You have your cheeks, you have your temples, and you have the chin. For a female, that's how you create that V shape or the heart shape. For a guy, it's a little bit different, but once again, your volume systems are on the lateral portions of your face. When, I'll exaggerate my face, when you add volume to the middle, that's what's causing aging. So why would you take a filler and add more volume all throughout? That's how you correct it or assist the situation when it comes to nasolabial or small lines with filler. Another procedure that I do here, and what I prefer, is once again, how do we lift tissue off of this region? So depending on your skin quality, depending on how much volume you already have, then the other way to correct it is how do we take the tissue off of that area? And when I suggest that to people, they're like, hey, I don't want a facelift. I'm nowhere near a facelift. So we're not saying that, which if you want to, you can approach that. But what you've heard me speak about over and over is PDO threads. So with threads, what we can do is heaviness, take that heaviness off the front of your face. So what did we say? We said correct the issue first. So lift the heavy tissue off the front of your face. Then you can take filler to spot fill and blend. Or you do the combo treatment, which I'll show you another picture of, is lift that tissue off the front of the face, then use filler to spot fill, give back volume to the cheeks and the mid-face, and then if necessary, fill this area. With the nasolabial folds or the smile lines, you don't want to completely obliterate that area, meaning you don't want to puff it out, you want to give a bunch of volume to that area. You'll always have a little bit of a fold because that shows emotion. When you smile, it gives back that fold. So just conservatively do it, fix the underlying cause, and then you'll have a better aesthetic outcome. So two ways to do it, right? We talked about a filler, give back volume, then blend this portion. Secondarily, take PDO threads, lift the weight off of that region, build collagen, build the lifting aspect, improve the quality of the skin there, then you can take filler to spot fill. So hopefully that's a quick and easy way to think about how do we correct smile lines or nasolabial folds. Once again, give it a thumbs up, give it a like, and then subscribe to the channel. We'll do a whole lot more educational videos.